This is the title of the talk I was going to give. The Intel guy is here. He's going to talk about technology, exascale computing for advancing cancer analytics so that it can be done in, 10 seconds. Or the next generation wearables that are sort of had automatic diagnostics within it. Or nanoscale protein analyzers for the bloodstream. And as I was coming here today and flying here, I was like, you know what, I'm not going to talk about that. So I literally rewrote this whole thing on the plane. The slides are mine. I am graphically challenged, so don't complain. It's the best I could do. And I've decided to change the talk to this. Transforming Ourselves, a short tragicomedy in 5 acts with a happy ending. And instead of me being GM of Health and Life Sciences at Intel, I'm going to talk to you about something that's probably every bit as important. My own 25-year experience with cancer and getting rid of it, and my own health and survival. Because the transformation that I had to make the healthcare system do to be ready for a proactive patient like me taught me that it is not ready for somebody coming in with their own devices, their own data, their own plans and goals. And, technology is a magical and wonderful thing, but if we don't transform ourselves, the roles and responsibilities that we play as patients and as caregivers and as clinicians, until we're ready to actually make those fundamental transformations, no technology in the world, no matter how wonderful, is going to solve these problems. So that's what I want to focus on. So Act 1, kid or coot? I remember the day I was diagnosed with cancer incredibly vividly. It is like the sort of stereotypes that you see in movies of things in slow motion, and all the details are sort of still there. I was actually at UNC Chapel Hill. I was 19, undergraduate at Chapel Hill. I was running to an ultrasound appointment, so I did a couple of laps. The hospital's right here next to Kenan Stadium, where we'd watch the Tar Heels lose in football most of the time. And I actually took a few loops and ran and showed up at the ultrasound, and all 4 of my doctors were there at once, which I'd actually never seen. They weren't all from the same place, and I was like, that's not good. So I'm standing here with a sea of pregnant women all waiting to get their ultrasounds, and I didn't want to lose my place because they're like, you still need to have this test done, and they start telling me things like cancer. The only words I remembered were like cancer and chemotherapy. That's all I actually remember specifically out of that particular moment in time, because it really was like slow motion. I actually remember kind of looking around and thinking, wow, they're having ultrasound to figure out what life they're bringing into the world, and I'm having ultrasound to try to figure out what's killing me. And the contrasts were just pretty extreme. Now, it was the beginning of a war, basically, when they told me this, because there were 4 of them, and there were 2 main camps. They're literally right there in the waiting room. This was not a HIPAA-compliant conversation, let me tell you. They're basically arguing in front of me about what I really have. There's the kid camp, so one of the doctors was like, he's 19 years old, don't treat him as a little kid, because they thought I had Wilms tumor plus some other sort of pediatric oriented kidney cancers or kidney conditions. And then the other camp was like, he's 19 years old, don't treat him as an old coot. This was their word, not mine, right? And after I walked out of here, and for the next couple of weeks, I was in this battle. I mean, we really should have worn T-shirts or something, because there was the coot camp and the kid camp, and I'd be in the pediatric unit one day with kids screaming all over the place, and then sometimes I'd be in almost the geriatric unit where it was dead silence. And they couldn't really sort of sort this out, but they finally decided that coot camp won. And they said, okay, you have this rare form of a renal cell carcinoma that usually only people in their 60s and 70s got, and you have 9 months to live. And at first I got incredibly depressed. I'd say certainly contemplated suicide, but certainly didn't try to act upon it. And I was in this kind of fog, not really knowing what to do, and still having to undergo a lot of tests, and we started chemotherapy. This is a picture of me. I was 19, and I thought that sofa was attractive when I actually bought that with my own money. And a patient in a waiting room sort of grabbed me one day and sort of taught me that it's like, Eric, they don't know anything about you. These diseases, are done on studies of people who may or may not be anything like you, and the fact that they can't figure out whether they should treat you as a kid or as an older person should sort of tell you that. So I kind of changed my whole mental mindset because of this patient advocate, Verna, who taught me to be the way that I am, taught me to be a proactive patient. And my wife and I started, I remember, she's like, live every moment. We started going up to the mountains and hiking as much often as we could. This was my first day of chemo. We got me a puppy. That's my dog, Abby. That dog saved my life. That dog was so smart. I mean, she lived with me for 12 years, knew when I was in pain, would saddle up to my kidneys. She died of kidney cancer, ironically enough. But we started living our lives and having a very different experience because we got out of this diagnostic code box that we were in. I mean, everybody was so obsessed about what diagnosis code I was going to have, and then it just sort of floods out from there. The moment you're put into that box, okay, it's this rare form of renal cell carcinoma, everything else follows at that point. The finances and what insurance will and won't cover, the way that everybody in the future would see me because of that diagnosis code starting to color their interpretations. And I had a very difficult time getting out of that box. And I had 3 or 4 kidney conditions going on at once, and none of them under microscopes looked like what they were supposed to. So there were some lessons that I learned during this part as I started to try to become a patient. It's like these diagnostic boxes have incredible gravity within the healthcare system. And if you don't slot into one because your demographics doesn't quite fit or other things don't fit, doesn't matter. One gets put down and everything starts to flow as a result of that, whether it's correct or not. And also I realized at this point that these are incredibly blunt instruments and very limited data informing these decisions. Unbelievably well-intentioned expert people, but with these blunt, crude instruments trying to understand, needles and images trying to extrapolate from these limited data points what was wrong with me. And I discovered as a patient, as I sat there in many other sessions watching these people argue often in front of me, that emotions and ego matter. The emotions and ego of the clinicians matter. The funding of some of the universities I was at and what their sort of specialty cancer areas matter. Because if they're funded to sort of work on nails, everything starts to look like a nail. And it's well-intentioned, but suddenly you're going down paths because of the manifest destiny of the diagnosis codes that you've been given. Act 2, missteps and missteps. So for the first 10 years of dealing with this cancer, I was pretty lucky. The biggest problems that I was having, because I was hopscotching amongst jobs and grad school, and I was kind of moving west. Went to grad school, went to another place for grad school, got a job, and ended up in Silicon Valley. And after 10 years of lots of chemo, I was really struggling with chemo brain, right? Just confusion. I still struggle with it. Confusion and other kinds of problems from all the sort of toxins and drugs that I had actually been on. And I found that exercise really helped me. Anybody recognize this? Sport brain? Any of you have a sport brain? This was 10, 11, 12, 13 years ago. Internet-connected pedometer. That little stand, you'd wear it on your waist, would count your number of steps per day. Here I have my Fitbit on. Right? This is the beginning of the Internet of Things for wellness monitoring and quantified self, I would argue. And that little station plugged into a modem, it would make that noise as you were dialing in to get it to sort of do that, right? And just motivating myself and tracking my own data and becoming a quantified self, even though I don't like that word and it actually never existed back then, helped me sort of stay motivated to deal with the exercise and to start to deal with the things like chemo brain. It just sort of opened my brain up. But then I also started to have pain. I was really lucky for that first decade. I only knew that I had cancer because experts with needles and images were telling me that I did. I didn't have any physical embodiment other than occasional blood in the urine that told me that I really had cancer. I had to trust. And I was actually, strangely enough, thankful when I actually started to hurt in my kidneys and have the lower back pain. And then after a couple months of that, and it really grew and grew and grew, I was no longer thankful and really wanted to get rid of it. And again, exercise really helped me. Right? And I would plot out, this is from the Sport Brain, I actually found this, I think the date on it was 2003, I found a screenshot of this, where I was actually looking at my motion and looking at what was going on. So I was trying to exercise for chemo brain, I was trying to exercise to help me deal with pain, and I noticed one day that there would be gaps in the readout from the Sport Brain where it wasn't monitoring my steps. I'm like, this damn thing's broken, I sent it off, paid another $99 and got another one to come in, and there were still these gaps. But I started matching up that data with my journal. I've been keeping a journal since 3rd grade, and they were asking me to keep a pain journal. And I actually started to notice that the places where the pedometer was not picking me up were the places where I had the most pain. And strangely enough, the poor accelerometers in this Sport Brain were becoming a pain monitor. And I was actually starting to figure out, because I was changing my gait and posture when I was in pain and the accelerometer could no longer pick it up, I was actually able to start looking at times of day and correlations about what was either causing my pain or just were the instances where I had pain. So I took this to my doctor, And my doctor was like, just take painkillers, and started giving me medications after medications after medications. And these things just made me feel worse. It was like chemo brain was worse. They just masked the pain. They didn't get rid of it. And I was really frustrated. You could see in my sport brain when I went on these painkillers that I was failing at my number of steps per day because I just started reducing because the drugs were having nasty side effects on me. So I finally went back to the doctor and I was like, I want you to approve for me to go see a physical therapist. And he finally did. He was very begrudging about it. He didn't actually really have a good recommendation of one. But I went to the first physical therapist, and this person's like, I don't work with cancer patients, too complicated. So I get a second referral. I go to this PT person, and they're like, you want me to use this data? I'll get sued. I don't actually know how to do treatment based on this data. I can't do that. And I went to the third similar kinds of response, and it finally took me 4 physical therapists before I got to somebody that's like, hey, that's really interesting. And they started creating custom exercises for me to help me reduce my pain based on this crappy accelerometer that was in this sport brain and helping me figure out patterns of what was causing things in my own life and bringing great ease to me. Now, when that back pain got so bad and suddenly I do this sport brain, all of this sort of taught me a couple of lessons about what it takes to be a proactive patient in a world that should accept proactive patients. There was resistance to using my data. Liability is the first excuse anybody will use in the healthcare system when it's not convenient or they're afraid of doing something because it's new. The second excuse is actually, there's no trial data actually showing that if we use this kind of data, it might make you feel better. I'm like, there's no randomized controlled trials that show that a hospital or a clinic is the best way to actually have care done either, but we do it because it's common sense and it's what we've done in the past. And I really learned here that no one else was going to coordinate your care. This was something that I had to do. So Act 3. El Nino chemo. I am snow obsessed. There's probably a DSM code for people with as much snow addiction as I have, and I have been all my life, and it gets worse every year. Dog obsessed, garden obsessed, and snow obsessed. So this is a picture of me in Utah hugging the ground because the neuropathy from the chemo and the cold made things worse. And I was starting on these incredibly toxic drugs that they were giving me in high dose to just get to the point where I couldn't do these hikes or I was just so exhausted from them. And it was really hurting my quality of life. And the next winter, my calendar was on a collision course. My chemo schedule was on a collision course. They were going to start me in chemo in like November in Utah, and El Nino was coming. I knew it. It was going to be epic snow years. Alta was going to have like 6-foot snowstorms over the weekend, and they're planning to put me on the biggest toxins you've ever seen. I'm like, stop. I'm like, give me low doses over long periods of time. And all those excuses. I said, let me do it at home. I said, I don't want to be in the hospital where I'm at risk for infection. I want to do it at home. I want to do self-infusion. You can train Ashley on how to do it. Oh, no, we can only do that for people age 65 and above. And I'm like, well, you've treated me like I'm 65 and above for all these years, so don't I get to use it as well? Because they could do home infusion for them. And finally, after just doctor after doctor, argument after argument, insurance company after insurance company, they let me have it my way. They let me have it at home, low doses, long periods of time. Now, when I did my first TED Med talk years ago, David Agus, this famous cancer guy, stands up and says, there's a whole field called metronomic chemotherapy now. It's all based upon the premise, and there's now studies to show it, that low dose over long periods of time is much healthier than these high dose toxins. And I'm like, do we have to do a randomized controlled trial for things that are common sense, really, every time? And that's part of the challenge with this. So the lessons learned here was, healthcare has a longevity obsession. My doctors were so focused on trying to get me to live for the long period of time, and I'm like, optimized for snow time. I had sticky notes that I made them put on the chart that said, optimized for snow time, even if it kills him. I'd rather live a shorter life where I'm in the snow than live forever with the kinds of side effects that you guys are giving me. And there was no place for patient goals, literally. I used to have to show them how to cheat the system when they first started getting electronic health records to use the nickname field to call me snow-obsessed dude in the nickname field. So they would remember, and it would stop them and make them think, what is Eric's goal? And how do I design a care plan and a curriculum to get him there? And this wait for the randomized controlled trial mentality for everything in healthcare is an excuse, and it can be deadly. So Act 4, a lucky sequence of events. By the time, over the last 5 or 6 years, with the exception of the last 2 where I've been healthy again, things were actually pretty dire. I was in full kidney failure. I was trying to not go on dialysis because it would limit the range of chemotherapies that I could actually be on at that point. And for the first time in my life, I started thinking, okay, They had told me you're going to die every 9 months, every year for the last 20-some years, but I actually was like, I'm not sure I'm going to make it out of this one. And I was already so happy when I turned 40. I was like, this is cool. I never thought I'd be 30, let alone 40, so anything here is sort of gravy. And I had a chance encounter where a company that had seen me speak said, hey, why don't we sequence your whole genome? And I was like, okay, and they did it, and they sent me these hard drives with a 5 terabyte file in it. I'm like, great, what do I do with this, right? I mean, this whole genome sequence is like, there's nothing I can do with it. But little unbeknownst to me, they actually had gone and worked with my clinicians, and it took them 6 months across both coasts. They were FedExing these hard drives back and forth to try to make sense of it. And I come in for one of my routine appointments. I was going to the doctor twice a week at that point because I was so ill. And I walk in, and oh, God. I had 4 doctors again, all of them in the same place, 2 by Skype, 1 on the phone and 1 in person. It's like, whoa, okay, what the hell now? And they're like, well, we've been playing around with this genome that you had done and working with the company who did it and several of the expert places around the world. And well, the long story short is none of the diagnosis codes we ever gave you, and at that point there were 23 different ones, were actually accurate. And in fact, we now believe that 92% of what we ever put you on was destined never to have worked. And the good news is we think we know something that will work. And even though my pancreas was fine, they gave me a pancreatic cancer drug, 4 months of chemo, and I walk in, and they did the tests two times and wanted to do them a 3rd time before they finally said, holy crap, you're cancer-free, you're eligible for a kidney transplant. Me, Mr. Proactive Patient, I've helped over 1,000 cancer patients over the last years, had never even Googled kidney transplant because it was never in my conceptualization that I would actually have one. So I quickly went and looked, and that becomes the happy ending, right? So this sequence changed everything about my life and shows that they had mistreated me. That original discussion of kid or coot and so forth, little did I know, and then in retrospect, I can look back on that and say, yeah, that was a really important conversation. I should have listened to that more closely. They really didn't know. When Verna was right, she's like, they don't know you, and they don't know my body, and they didn't know how to treat it. All well-intentioned. There was no badness and evil in any of this, right? It's what the system is designed for, and it's the tools we have available. So that leads to Act 5, this happy ending for all. This is the Intel employee who didn't even know me and donated a kidney. That's a couple of days after my transplant in my house. Got my mask on, dealing with infection. My 2-year anniversary is September 24th, so later this month from the transplant. I just had my 2-year visit to the transplant clinic last week. Completely healthy, perfect kidney function. My doctor said pristine urine. I was like, I know you people don't get excited about your urine, but when mine's pristine, I'm celebrating that. And I'm running 5 or 6 miles a day, and like I was when I was 19, even though I'm age 46. Now that's good news for me, but we know that I am a rare exception. Over those years, I made a lot of money in tech because I was doing telehealth companies 20 years ago, even though nobody will still do telehealth today, right? I'm paid well, I'm educated, I speak English, I have access to the who's who of cancer specialists, to senators to help me work on policy issues about home-based care. I am not representative. If we think back to these acts, I was neither kid nor coot, right? But we need a healthcare system where patients are treated as complex adaptive systems, and that's where we're headed, where they're treated as complex adaptive individuals, and we customize care for that. I really benefited from that sport brain and PT data because I was a tech, early user, and real-world data for truly coordinated care is where we've got to go going forward. And if this healthcare system doesn't get comfortable with us coming in with our own devices, our own data, and doesn't learn how to use it and incorporate it, then we are not going to scale the kinds of happy endings that I have to the rest of the population. Snow time and slow chemo at home worked for me, and it was a fight all along the way to do that. The default ought to be care at home with as minimal impact on the person as possible if that's what their goal and choice is. And quality, as we talk about all these quality movements, has to define part of quality metrics being, does it include patient goals and preferences? And we're going to have to teach patients to even articulate what their goals and preferences are. And then finally, I'm here due to a lucky sequence and an amazing donor. But we're headed towards a healthcare system that has the potential, and the technologies are there, to do care customization for my body. N equals 1 medicine, a sample size of 1, me. The problem is, none of this is going to scale unless we transform ourselves first, unless the healthcare system doesn't try to thwart and contain proactive patients like me, but actually support and train patients like me to do this. And if we don't make these tools widely available and cheap enough, where well-intentioned physicians who have been doing miracles in the dark, in the data dark, suddenly can actually customize care for you, that's where we're headed. But we've got to change the caregivers, the clinicians, the patients themselves, and have new social covenants, new roles, new responsibilities. Technology will support all of that, but until we start to do that, we're going to be in trouble. So let's transform ourselves. The rest, including the technology, will follow. Thank you very much.
So, Dishmeister.
Yeah.
So nice to be on stage.
It's nice to be on
I guess I should call you
Oh my God, they called me all through high school and into college, so you know the secret.
But I should probably call you Sod, right? Snow-obsessed dude?
Snow-obsessed dude. I don't know where it comes from, but it kept me alive.
Let's talk about age 19 for a second.
Okay.
I was 19 when I had my accident. You were 19 when you got your asymptomatic diagnosis. That's interesting.
Yeah, there's always the other category. So.
Yeah, why does a 19-year-old believe a doctor telling him that he has cancer when he has no symptoms?
It took them a long time to convince me. I was training for a marathon at the time, and I thought the bleeding that I was having was because of just the pounding of the pavement, particularly with young runners that does that. You know, they would show me these scans and these images, and you could clearly see that it was originally in the left kidney and eventually moved to the right, but you could see real differences. And just the gravity of that word cancer, it turned me into a passive patient. I mean, the moment I heard the proclamation of 9 months in cancer, that so overwhelmed me that I just reached out for experts to save me and did anything they wanted. And I had to unlearn that later on.
You know, your experience is exactly what happened to one of the most acerbic and acid-tongued skeptics who's ever walked the earth, Christopher Hitchens, who for years talked about presidents and world leaders and economies and you know, absolutely nothing was sacred to him. But the moment he was diagnosed with esophageal cancer, he believed everything that came out of all these doctors. He described himself as in the place called malady, and he was the most passive patient.
I see it. I mean, I still do all this advocacy for patients, and sometimes there are people that just work at Intel, there are executives that call me and say I need help, and you watch these incredible Fortune 100 powerful executives who are used to controlling everything in their lives, and I'm like, stop behaving like a puppy. Stop letting the healthcare institution just do this to you. Think twice, get third, fourth, fifth opinions, collect your own data, and be the GM of your own health, and they just don't know how to do it.
Because I'm a journalist, let's talk about a couple of details that emerged from your story that you didn't really elaborate on, but I have a couple of questions about. Number one, you were married at age 19?
No, I didn't. We didn't get married because we were too worried that my wife had a little bit of savings that her parents had left her. We both grew up middle-class kids in North Carolina and Tennessee. So we didn't get married until I came to Intel because we were too worried about
dating when you were 19.
She moved in with me. I was very sick, and she moved in knowing that I was sick. She moved in. We started living together in sin. Her parents were absolutely appalled until they understood the context that it's like I needed help when I was on heavy chemo, just feeding myself. Those were pre-Zofran, pre-nausea drug days. So chemo back then, you saw how small I was. I was never a big guy even then. You were hugging the porcelain toilet all night long. When Zofran came out, it was miraculous. But I had to have people care for me, and we fell in love, and she has been with me this entire time, 25 years.
I had a lot of dates where I was hugging the porcelain toilet. It never really went anywhere, though. So,
it's a
unique story. I knew there was a story there.
No, I mean, we didn't get married because we were worried because of there was a period of time where I was uninsured in there, and I quickly amassed about $600,000 worth of debt that I only paid off like about 7 or 8 years ago, right? And so I followed insurance. I knew the Google folks before it was called Google when I worked for Paul Allen, and I had a chance to go work at this new company working on search, and I had been working on search for Paul Allen. And I didn't go because they didn't have health insurance at the time, and they wouldn't cover pre-existing conditions. So I have chosen my career based on where I could get good insurance, because once you were burned $600,000 in undergraduate and graduate school, right, it took forever to come out from under that rock.
And there was Google was in its infancy, so working for Google didn't
mean anything. It's just
it's
a startup with,
my problems were solved.
It's a startup with no insurance. I mean, people ask me if I'm bitter about this, and it's like, well, no, there was no way of knowing, and I've never sort of operated my life based on money. I've operated my life on snow time, garden time, and Ashley time.
Okay, you said we have to transform ourselves, but the problem with that is people who are healthy don't have the same motivator as a 19-year-old who's been told he has cancer.
Yeah, that's right.
So how do we work that?
It's interesting. We just had a high school intern that worked with us for the summer, and he went and did focus groups and interviews with people his age, and was like, do you care about the iPhone and the Android phone and all these apps on health? And they're like, no. But he came back and said, well, actually, what would motivate us is if you actually had an app that actually helped the guys who are trying to gain weight and look more muscular sort of walk them through that. He's like, we just haven't found the right triggers and the right sort of value propositions that sort of get younger people to do that. I don't know how we do it. I mean, I'm a social scientist. We study behavior change. You know, I know that there have to be ways in which we can show people tools that will help them now because of, and it's like buying insurance, right? Everybody hates to do it, but it's like, you know, you need it there for a catastrophe. I think if you step back from that and actually we say, we're going to start training people to be the GMs of their own bodies from an earlier life, right? That is just part of the way that we do parenting and so forth. I mean, you're going to have to sort of go back to that, right? And we're going to have to teach people that they need to be proactive about their own health and wellness, because undoing the powerful gravity of the passive patient just walks in and lets the system do whatever they want to them. I mean, of the 1,000 people that I've advocated for, I've kept the journal the whole time, and I'd say about 600 or 700 of them I was able to sort of flip the bit and get them over. Almost all of them start in the passive phase and get them into the proactive phase. And you know, the first thing to do is to ignore the numbers that the doctors give you. Get a team of people around you, and for the ones that do it, they almost always live longer than the numbers that their doctors have given to them. For those, and I've tracked it, for those who don't, it's like we die on schedule, right? The doctors are right because we just construct ourselves towards death just to do it right on time if we can't break out of that mentality.
You described that some of the doctors would argue with you about your symptoms to try to get you to conform to their understanding of the diagnostic code,
yeah.
Right? And you know, I had this experience also. I remember, you know, my reaction to paraplegia wasn't following the normal sort of trajectory. And you know, people would come into my hospital room and they would say, well, you're 19, you know, what a horrible tragedy. And I would feel like, no, this is actually, it'd be better to have this now than to have had all of your life or be in the middle of like a family with 4 kids. But
right.
You didn't want to say that because people would go, no, 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 you're 19. This is really, really a terrible situation. You must be considering suicide. And I'd be going,
I wasn't until you suggested it, thanks.
Yeah, I'm not considering it. And they said it so much that I actually thought, you know, maybe I should really be considering suicide because I don't think I'm dealing with this in a healthy way. And it got that ridiculous.
I was in exactly the same ballpark.
Right.
I mean, this is the problem, right? The weirdos like me who, for whatever reasons, become proactive patients are the exception, not the norm, and we need to try to make a higher percentage. Not everybody's going to have the literature skills, the reading skills, and all of that to be able to do this. But hey, what if we made 30% of people sort of proactive patients? Watch the impact on their quality of life and the cost of savings. And now bring in all these tools from the wearables and all of that. I mean, if we look today, Intel just did an analysis of this, across the world, we looked at the total number of consumer health devices that are out there, and less than 1% of them, those consumer devices, are being used any meaningful way in clinical encounters yet. It's not because they're not collecting interesting data. It's because we don't have the relationship infrastructure and the finance infrastructure for the healthcare system that we need to use it in a compelling way. Mark Bertolini was right. Once the finances change, we're starting to see innovation happen. But now we'd have to do a radical rethinking of what it means to be a patient, what it means to be a caregiver, what it means to be a family caregiver, and what it means to be a clinician. And we got to let go of that sort of the past that we're just stuck in.
But even the technology has to get rid of this norm idea. My wearable, you know, thinks I'm dead when I'm rolling around in a wheelchair because it doesn't get the steps. I mean, when I'm asleep, that's when I'm alive.
Yeah, it's
a little disturbing.
I will call the engineers and we'll get working on it.
Get working on that. All right. Last question, and it was a detail in your talk. You were told by 4 doctors, 2 on Skype, that the treatments that they had done based on their analysis of your genome over a period that exceeds a decade, right?
Yeah, 20.
92% of those treatments probably had no chance whatsoever of working for you.
Yeah, and they had no way of knowing before.
Right, right. And the very next thing they told you was, you can have a kidney transplant.
Yeah.
So they told you that we've been giving you a line of horseshit for a decade.
Yes.
Now we want to open you up and give you somebody else's kidney. And you said, fine, sign me up. Hello?
Well, they didn't immediately say you can start a kidney transplant. They said, we're going to put you on a drug, and here's why. This data, this genomic data, has helped us understand the mechanism of what's going wrong in your body. I mean, at the end of the day, we're going to look back and not that far out in time and say the notion of breast cancer and kidney cancer and all of that is just not even real. There's going to be 10, 12, 30 different mechanisms that cause cells to go crazy. And we're going to get good at turning those mechanisms off over time. I think we're about to sort of see a whole area. But why was I actually willing to do it? It was because at that point, I did believe I was going to die. I mean, if you had seen me 2.5 years ago and you saw the person that's here right now, you wouldn't believe it, right? I mean, and I look back at the pictures of me just 2.5 years ago, and I was like, holy crap, I have beat this for 23 years longer than they ever said, but if I don't do something, it's going to be the end. And now I'm just fine.
And we're glad you did.
All right, thank you, sir.
Eric Dishman.